All right, today we are diving deep into a really critical medical state, something that's way more complex than it sounds: circulatory shock. We're going to break down exactly what it is and then play detective, investigating the 4 different ways it can bring the body's entire delivery system to a screeching halt.
So let's start with the basic definition. At its core, shock is simply a state of circulatory failure. You can think of it like the entire delivery network for a massive city just shutting down. The result is something called inadequate tissue perfusion, which is just a clinical way of saying that blood, the stuff carrying all the vital oxygen and nutrients, isn't getting where it needs to go.
And that leads us to the real central problem, cellular hypoxia. When that delivery system fails, your body cells are literally starving for oxygen. And this isn't some small issue, right? It kicks off this incredibly dangerous chain reaction, forcing cells into an emergency backup mode that just can't last, leading to widespread organ damage.
So here's our game plan. We're going to look at the 4 main types of shock: hypovolemic, distributive, cardiogenic, and obstructive. And then we'll put them all side by side to really see the differences. Let's jump in.
First up is hypovolemic shock. Now to get this, let's use an analogy. Imagine your circulatory system is a big delivery service. What happens when you just don't have enough delivery trucks on the road? Or, in this case, not enough blood volume?
Well, you can lose that volume in a few ways. The most obvious one is hemorrhage, bleeding. But it can also happen from things like severe burns, which cause a massive loss of fluid, or even really bad vomiting and diarrhea. All these things literally drain the fluid right out of the system, leaving it running on empty.
So here's the domino effect. First, the total amount of blood goes down. That means less blood is returning to the heart, that's what we call preload. And if less blood comes in, well, less blood can be pumped out, so your cardiac output tanks. And of course, with less blood being pumped, your tissues just aren't getting the oxygen they need. It's a very straightforward and very dangerous cascade.
So what does this actually look like in a patient? The body, trying to save itself, goes into overdrive. The heart starts beating way faster. That's tachycardia, trying to push what little blood is left around more quickly. Blood vessels clamp down to try and keep the pressure up, and that's what causes that classic cold, clammy skin. But eventually, the body just can't keep up, and the blood pressure drops. That's hypotension.
All right, next on our list is distributive shock. We're going to call this one the pipe problem. So, what if you have plenty of delivery trucks and they're all fully loaded, but all of a sudden, every single road in the city turns into a massive 8-lane freeway?
The things that cause this are events that lead to what's called profound vasodilation, basically a dramatic widening of all the blood vessels. This can be triggered by sepsis, where a huge infection releases toxins, or anaphylaxis, which is a massive allergic reaction. In both cases, the pipes of the circulatory system just get way, way too big.
Now, here's what's so wild about this type. It creates something called relative hypovolemia. The body hasn't actually lost a single drop of blood. The volume is totally normal, but because the container, the vascular system, has gotten so huge, the blood just can't fill it up. It's like having the same amount of water in a bathtub instead of a bucket. The pressure just disappears.
And this gives us a huge clue that sets it apart from the first type. In the beginning stages, the person's skin is often warm and flushed. Why? Because all those wide-open blood vessels are bringing tons of blood right up to the surface. It's the total opposite of the cold, clammy skin we saw before, and it points to a completely different cause.
Our third culprit is cardiogenic shock. In our analogy, the delivery trucks are full, the roads are the right size, but the main engine back at headquarters, the heart itself, is broken. This is a straight-up pump failure.
And the causes are things that directly hurt the heart's ability to squeeze and pump. A big heart attack is the classic example. It just damages the heart muscle. But severe rhythm problems, arrhythmias, or just end-stage heart failure can also cripple the pump's ability to do its job.
The chain reaction here looks a little different. A weak pump means it can't push blood forward effectively. So not only does the body not get enough blood, but you get a traffic jam. Blood starts backing up in the system, and it backs up right into the lungs, causing fluid to build up. We call that pulmonary congestion. And you can actually see the signs of this backup. The jugular veins in the neck bulge out from all that back pressure, and if you listen to the lungs, you can hear crackles, literally the sound of fluid in the air sacs. These signs point directly to a failing pump as the problem.
Okay, this brings us to our last category, obstructive shock. So what happens if the trucks, the roads, and the main engine are all working perfectly, but there's a giant physical roadblock preventing blood from getting through?
The causes here are all about mechanical blockages.
A huge blood clot in the lungs, a pulmonary embolism, can act like a dam, blocking blood from leaving the heart. Or cardiac tamponade, where fluid builds up around the heart and squeezes it, stops it from filling up with blood in the first place. These are physical barriers stopping the whole system.
And this is the absolute key to understanding this one. In obstructive shock, the heart muscle itself could be totally healthy. It's trying its best to pump, but it's being physically squished or blocked, so blood either can't get in or it can't get out. The pump is fine, but something is holding it back.
And the clues you find are super specific to the blockage. With cardiac tamponade, that fluid around the heart makes the heart sounds really quiet and muffled. With a tension pneumothorax, the pressure in the chest gets so high it can actually push the windpipe or trachea over to one side. These are telltale signs of a mechanical problem.
Okay, so we've met our 4 culprits. Now let's line them all up, side by side, so we can really see what makes each one unique and how we can tell them apart.
This table just lays it all out perfectly. Let's look at that primary defect column, because that's the key. Hypovolemic, it's a volume problem, not enough trucks. Distributive, it's a pipe problem. The roads are too big. Cardiogenic, a pump problem. The engine is broken. And obstructive, a blockage problem. There's a roadblock. See? Each one attacks the system from a totally different angle.
Which, of course, leads to the most important question of all. So what? Why does knowing these differences actually matter when someone's life is on the line?
And this is why it's everything. While the final result looks the same, cells starving for oxygen, these 4 types of shock are completely different problems at their core. You can't fix a broken pump by just adding more fluid. In fact, if you give a ton of IV fluids to someone in cardiogenic shock, you could make things catastrophically worse. Figuring out the type of shock is the absolute #1 key to giving the right life-saving treatment. When you get right down to it, understanding shock is really about appreciating the body's incredible logistics. It's this beautiful system where the volume, the pipes, the pump, and the pathway all have to work together perfectly. And knowing how to spot the difference when one part fails isn't just some academic exercise, it is the very first and most important step in making it right.